Your doctor probably never told you that the symptoms of your arthritis can improve even if the joint stays exactly the same. In today's video, I'm going to reveal 5 more truths about arthritis that your doctor probably never told you, because knowledge is power, and the more you understand about this condition, the better you can help yourself at home. My name is Harlow, and it's my job to help active over 50s to improve their arthritis symptoms, to get them moving again, and to reduce morning stiffness. Now, doctors are great at helping people generally, but sometimes with arthritis, the information they share can be disempowering and it can feel like the only solution is surgery. But I want to give you 5 truths that are going to help you to improve your symptoms today and get you back to your active life. The first thing you were probably never told about arthritis is that arthritis is not the process of your cartilage being rubbed away. It's actually way more complex than that, and it's a common misconception that our cartilage just becomes rubbed away over time. Now, if this was the case, what we would see is people who were more active would have worse arthritis, because more activity means more rubbing, which means the cartilage gets rubbed away. But that's not what we see at all. We actually see the opposite. So people who are very sedentary, they end up more likely to be at risk of arthritis than people who are very, very active. Now, there's lots of nuances here, and I'll explain more as we go through the video, but there's a far better way to think about what goes on inside our joints to cause arthritis. I'm going to try and explain some of this with a terrible drawing that I made earlier, okay? Now, we've got 2 types of cell. We've got multiple types of cell, but there's 2 major types of cell within our cartilage. We've got a cell called a chondroblast, okay? And a chondroblast, B stands for builder. So chondroblasts are your builders. They come along and they lay down new cartilage. We also have a different type of cell called a chondroclast. And the clast, C stands for collector. So the chondroclasts, they collect old cartilage, and I've made an awful drawing of a wheelbarrow there because I had no idea how to represent a collector otherwise. So we've got these builders and we've got the collectors, and they're both working all the time to try and keep your cartilage healthy. So neither of these types of cell are good or bad. They're necessary, they're needed, and the chondroclasts are there to try and collect old cartilage, and the blasts are there to come and lay down new cartilage. Now, when our bodies are in equilibrium, when we're kind of in our middle 20s and 30s, we probably have a very even amount of activity between our chondroblasts and our chondroclasts. And on a graph, that would look something like this. So we've got a completely even amount of activity, which is shown on the y-axis, between our builders and our collectors. They're both doing about the same amount of work. And what this means is our cartilage stays completely stable. Every time the collectors take away old cartilage, the builders come in and lay down a new brick, so to speak. But as we get older, what tends to happen is this. So what's happening now is your collectors have become more active. So they're collecting more of the old cartilage, but the builders can't keep up. They're now less active. So your collectors are taking away more than your builders can build, and you end up with a net loss of cartilage over time. So why is this important? Well, one of the main reasons this is important is because physical activity has been shown to slightly downregulate your collectors and upregulate your builders. It basically sends a signal to your cartilage that we still need it. So the more active you can be, the more you can do your mobility work and your walking and your strengthening, the better this balance will become. The next thing you were probably never told about arthritis is that 50% of arthritis seems to be down to genetics, and the other 50% seems to be down to lifestyle. Now, genetic factors are a very tricky thing. Have you ever met someone who just has arthritis that runs in their family? Maybe that's you. Maybe every female on your side of the family, from your great-grandma to your grandma to your mum, now to you, has suffered in some way with arthritis. And the sad fact of life is, yeah, there is definitely a strong genetic component with this condition. But studies have shown over and over again that the other 50% of how bad the arthritis gets or how much it affects you, does remain within our control. And when we're talking about lifestyle, what we're talking about is your environment, how you treat your joints, how you are in your general health, how good your physical activity levels are, what you do in your job. All of these things can make a massive difference to how much arthritis you get and how symptomatic your arthritis can become. So even though that 50% is out of your control, the other 50% is firmly in it. And the rest of this video is about how to maximize that 50% that remains squarely in your court. Before we go any further, I just want to tell you about 3-Tip Friday. 3-Tip Friday is my weekly email that I send out to my list, and it features 3 of the most interesting things I've found that week. It could be a health tip, it could be a piece of research I'm reading, or it could be a new tool that I've found to be really useful for helping people get more mobile. It's totally free. I just send it out once a week. There's no annoying promos inside, and you can sign up for it by going down below this video and entering your email in the 3-Tip Friday link. The third thing you were probably never told about your arthritis is that the severity of your arthritis does not correlate very well with the severity of your symptoms. Now, this might come as a surprise to many people who think that, if I've got bad arthritis in a joint, that obviously means I'm going to have bad pain. That's actually not the case at all. Now, we see this time and time again in the practice. Someone will come in, they've got a problem in their lower back, let's say. They have an x-ray of their pelvis and their spine. And guess what? The pelvis x-ray shows that one of their hips has got almost bone-on-bone arthritis. And you say to them, have you ever had any hip pain? And they're like, nope, hip's absolutely fine. And we see that time and time and time again. And if you're over 50 watching this, the odds are you've probably got arthritis somewhere in your body, but you may not be aware of it because you never felt the symptoms. And in fact, studies have been done over and over again to show that almost 100% of people over the age of about 40 have got arthritis somewhere, and only a very small fraction of those people report the symptoms of arthritis. When I say small fraction, we're talking somewhere between 3 and 6% of the population who suffer really badly with like a hip arthritis or a knee arthritis, okay? So when we're talking about arthritis in this video, really we're talking about symptomatic arthritis. So why do some people get symptoms and others don't? Well, there's lots of different theories for this, but one of the things that's been proven is that the things going on around that joint have a massive influence on your symptoms. So if you're someone who's got some knee arthritis, but you've got really strong quads and you've got really strong glutes, guess what? Your chances of having symptoms have gone down by an order of magnitude, okay? If you're someone who's got the same arthritis, but you're weak in your quads, you don't do much exercise, you've got quite a stiff knee, your hips are weak as well, then you've got a much higher risk of having the symptoms. And the other thing is, just because you've got symptoms today doesn't mean you can't remedy these problems. So the things that are going on around the joint, if you fix those, guess what? Your symptoms can decrease as well. I've literally built my career on helping people to do that. So arthritis is not a life sentence. Just because you've got it doesn't mean it's going to stay symptomatic forever. And if you do the right things, many times it can be improved. The next 2 points will reveal exactly how to go about improving those symptoms. The fourth thing you were probably never told about arthritis is that improving your range of motion at the affected joint can correspond to a massive improvement in your symptoms. In a study done at the Shelbourne Knee Center in the US, loads of patients came to them with knee arthritis, and following a simple protocol where the researchers prioritized improving their range of motion, they prevented 70% of their patients from progressing to knee surgery. They first focused on improving the extension of the knee joint, which is making it nice and straight. And once they'd achieved that, they focused on the flexion, which is bending the knee joint and restoring that range of motion. Almost all of the patients that I see who have got symptomatic arthritis also have a stiff joint, and that applies to the hip, the knee, the shoulder, wherever the arthritis is. So when I see patients who have arthritis, one of the first things we do is try to restore that range of motion. Now, it's a gradual process. It takes many weeks for most people, but week on week, you should start to see some improvements. And to get those improvements, you have to do something every day to try and improve it. It's like you must be doing it little and often throughout the day to really see a change. But most people can get that change, okay? And what we find is a pretty clear correlation between an increasing range of motion and a decreasing pain. This makes perfect sense in my mind because every joint in your body can only function when it's got an almost full range of motion. And if it doesn't have that full range of motion, it's not working as it was designed, the muscles around it can't activate properly, and other areas have to pick up the slack. So I prioritize restoring range of motion as one of the most important things when it comes to arthritis. I do have a video dedicated to the Shelbourne knee study, which you can see in the top of your screen right now. It gives the step-by-step approach that they used to fix their patient's knee arthritis. And the other thing you can do if you are suffering right now with an arthritic joint and it feels very stiff, I've got tons of exercises to help in my book, Thriving Beyond 50, and you can find a link to that below this video. The fifth thing you were probably never told about arthritis is that strength in the surrounding muscles is absolutely vital and can truly improve your symptoms. One recent study showed that the strength in someone's quads was a better predictor of whether or not they'd have knee pain than the actual appearance of their knee on an X-ray. So even in people who had quite severe arthritis, if they had strong quads, they were less likely to have pain than someone who had more moderate or mild arthritis but very weak quads. So strength around the joint makes a massive difference, and that's the second part to my plan for helping people improve their arthritis. One major study found that for every 10 pounds per square foot improvement in your strength in your quads, you had a 29% decrease in the chance of having symptomatic arthritis. And a 10 pound per square foot gain in your strength corresponds to most people for about a 20 to 25% improvement in the average person's strength. Now that's super doable. You can do that in 4 to 5 weeks of concerted effort for most people. So getting that 29%, 30% improvement in your symptoms might not be that far away if you give it a concerted effort. For strengthening, I like to focus on the weight-bearing joints, working them in a way that challenges the muscles but doesn't hurt the joint and doesn't aggravate your arthritis. This tends to be the sweet spot, and different exercises work better for different people. As an example, for knee arthritis, I love the straight leg raise, which you can see on your screen now. That works the rectus femoris muscle at the front of the hip. It's also one of your quads. And I also love the sit to stand with a slow decline back into the chair. Now, the reason I like that is because it's really functional. We do it all the time, and it works your eccentric muscle contractions as well, which are super important to help you come downstairs and to get on and off the toilet and into and out of cars. For hip arthritis, I often give people an exercise called the clam, which again you can see on your screen now. That strengthens up the abductor muscles on the side of the hip. They're super important for supporting your hip when you walk. And I also like the bridge because the bridge strengthens up your hip extensors, so your gluteus maximus. It also works your thigh muscles at the front here. They help to support your hip as well. And it also switches on your core. And the bridge tends to be non-painful for people with hip arthritis most of the time. For lower back arthritis, I like to strengthen two areas. The hip abductors, so I use an exercise called hip abductions in side lying, where the patient lifts their leg up towards the ceiling when they're lying on their side. It works your gluteus medius and minimus. And then we also like to strengthen the core because the core wraps around your midriff. It supports your spine when you bend and twist and move. And for that, I like what we call toe dips, which is where you lie on your back, your knees are bent up like this, and you just slowly drop one leg down at a time whilst keeping that core activated. These can be really effective for shoring up the area around the spine. For the shoulder, it's all about strengthening the muscles in both the rotator cuff and the muscles that support your shoulder girdle. So one of my favorite exercises for this is the bent arm front raise. You basically are bringing your arm up in front of you against some resistance. That activates much of your rotator cuff and also some of your deltoids as well. And I also like some variation of a row. Typically a band row works really well, or you can use dumbbells like in the video if you prefer. Obviously, those exercises aren't going to be suitable for everyone, but there's something in there that can help most people with most forms of arthritis. Now, if you've found some benefit from this, I hope you apply these messages and share them with someone else who needs to know about it. Arthritis is really poorly understood, and we need to get the message out that people have more control over this condition than they might originally have thought. So those are 5 things your doctor probably never told you about arthritis. And if you do have arthritis and you're interested in getting help for it, you want some exercises and my best advice for how to improve it, then the best thing you can do is pick up a copy of my brand new book, Thriving Beyond 50, the 2024 edition. It's got chapters and chapters dedicated to arthritis inside. It's got things about knee, hip, lower back arthritis, anywhere you might have it. Hopefully this book has got the information inside to help you find some relief. There's a link below this video to get your copy. If you want to just keep enjoying the channel, that's totally fine as well. Just make sure you've liked this video and subscribed. And if you want to leave us a suggestion for a future video, then please do just drop a comment below, because we do read all of them and we thank you for your time. So thank you so much for watching, and I'll see you again on the next one.